Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 4 Clinical Governance, Leadership and Risk Management in Healthcare, in Chapter 47 Risk Management in Hospital and Healthcare Part 3, we will be studying about Introduction to HFMEA, Step 1 and Step 2 for this, Step 3 and Step 4 for the process mapping and hazard analysis plan, and Step 5 for action plan development, and Step 6 for follow-up review and risk evaluation. What is an healthcare failure mode and effective analysis, that is HFMEA? The HFMEA is a healthcare specific failure mode and effective analysis tool which is to adapted for the UA, that is United States Department of Veterans Affairs Analysis. So it has been designed by the VA, that is United States Department of Veteran Affairs, to analyze the healthcare failure modes. The failure modes, which refers to identifying the different ways in which a process can go wrong, where it more emphasizes on the failure modes. If I have to give an example for this, while administering the medication to a patient, all 6 rights, that is the right individual, right medication, right dose, right time, right route, right documentation are very important. You have to understand when you are taking ahead for a medication, you need to consider all these 6 rights. If you are clear with this all, you can say the failure mode is lesser or not to be occurring. So right time and right documentation can commonly go wrong, which is very inevitable. These are the 6 failure modes for the administration of a drug. Failure mode effect refers to defining the outcome or result of the failure mode. If the wrong medicine or wrong dose is given, the outcome can range from no effect to death, and which is very common to be seen when there is no risk in this way analyzed. What may appear to be an uncommonly minor event can potentially lead to a catastrophic outcome. And you can come across with the different steps that we will be discussing about to take ahead this. The topic should be relevant and could be selected from previous incident report. So when you have to take the HFMEA topic, actually it needs to be selected from the previous incidents that have happened in the hospital, or the patient complaints, or the feedback from the clinicians, or experiences of other hospitals, or from the literature. Ideally, in the discussion, it should start to understand what are the incidents which are likely to happen, what are the complaints which have come commonly, and the feedback of the clinicians which are taken more into the first priority. The next step will be assembling the team. The team which is used as to be seen as a team for this task is like a concerned end users who are more into in relation to that. Might be the risk manager, quality officer should moderate the functioning of the team who has taken this task. This is one of the most important steps into all the 6 steps that we are discussing in the risk analysis, as the quality of the risk assessment is going to be as good as the team itself. If you are trying to understand the risk assessment in a proper way, you need to have this step as a very important, that assembling the team. The team itself should be a good team actually. So the team members should be motivated, they should be very enthusiastic, and they should be knowledgeable in the concerned area what the problem they will be studying it. So steps 2 is being taken as a very important step. This step is important step into the risk analysis assessment, and it has been seen as very appreciable when you find the outcome of all the steps. The step 3 is graphically describing the process. A process flow diagram should be developed. Each process step identified in the process flow should be numbered consequently. And if the process is complex, the areas of the process to focus on should be identified. A smaller process can be chosen, where you can make a graphical representation of it and can work on that to describe the process. The reason is to understand the minuteness of that and to even calculate actually what are the risks that is possibly occurring actually for this. Then if you go for the step 4, that is conduct a hazard analysis. List all the possibility failures mode for the process which are identified into the previous step, that is step 3, and various methods like triggering questions, brainstorming, cause and effect diagram, Ishikawa diagram are used to identify the potential failure modes. Because it is very important that when you are doing or conducting this hazard analysis, you need to come across with a failure mode understanding. So consequently, number these failure modes and transfer the failure modes to HFMEA form. The form is called as in the table 1. You will understand actually how this form will take ahead these failure modes. Determine the severity of each effect by using the severity rating the table, which will be given in table 2. Document the severity rating on the HFMEA form. This forms is very important. When you document, you will able to understand and you will determine the severity of each of the effect. You can see HFMEA form number 1. So there is in this form date is mentioned, process and HFMEA, which is given as a title over here. The team member's name is to be given over here, which will make it more clear that who are all the team members, what is the project and what is the process they will be studying like. The first phase is like the potential failure mode, then the potential effect, severity effect, you can see the potential causes failure mode and probability of cause. Then the hazard score, you can see recommendation based on the hazards actually, and the responsibility and target action and completion of the date. The severity effect, probability cause and new hazard score, which is given into this. So this form will give you an entire analysis actually like how the risk is taken, and the analysis will be clear over here. Now in the table 2 you will get the severity rating table. In the severity 1 you can see the catastrophic, the severity is rated as 4, where the patient outcome, death or major permanent loss of function, sensory, motor, physiologic or intellectual, like suicide, rape, hemolytic transfusion reaction, surgery, procedure, wrong type, wrong patient, wrong body part, infant abduction, all these are being seen into this. The visitor outcome is like death or hospitalization of 3 or more visitors. Staff outcome, a death or hospitalization of the 3 or more staff. Equipment failure like damage equal to or more than 5 lakhs. Fire, any fire that grows larger than beginning the stage cannot be controlled with probable fire extinguisher or even a small hose. Then is the major, where you can see major is like you can say permanent lessening of body fluid functioning, sensory, motor, physiological, intellectual, disfigurement or surgical intervention required, or increased length of stay for more than 3 or more patients, increased level of care of 3 or more patients. If you are finding it is more like a severe to next level coming as a major risk. Hospitalization of 2 or more visitors, visitor outcome you can come across. This is like a rating actually that you are trying to take it. The staff outcome, hospitalization of 2 staff or 3 or more staff experiencing the loss of time, restricted duty or injuries and all that. With respect to equipment, damage equal to or more than 1 lakh, fire not applicable. So you can understand the majority of a major risk is one with respect to this. Then comes the moderate part of this. Moderate risk is like increased length of stay or increased level of care of 1 or 2 patient. So it is like a moderate level of risk. With respect to visitor outcome, evaluation and treatment for 1 or 2 visitors. Medical expenses, loss of time, restricted duty hours, illnesses of 1 or 2 staff. With respect to equipment or facility damage between 10,000 to 1 lakh, and incidence of fire, incipient or beginning stage of smaller, which can be controlled by fire extinguisher. In minor particularly, there is no injury or nor increase in length of stay or not increased level, but there is a risk over there. On evaluation with respect to visitor outcome, evaluation and no treatment required or refused treatment, which is sometimes many times commonly being seen with most of the incidences for minor risk. Or with respect to staff outcome, first aid treatment only with no lost time, no restricted duties, injuries or illnesses. With respect to equipment like damage less than 10,000, which is a lesser in terms of utility, without adverse outcome. With respect to fire, not applicable, C, not catastrophic for the moderate part. So you can understand from minor to moderate to major and catastrophic. You may see the severity and the rating may come that minor it goes with 1, moderate it goes 2, major it goes 3 and catastrophic it goes 4. So you can use this table and you can understand more in depth actually with respect to the severity that is occurring in your institutions, or you can work it as a project actually to understand this issue more. The step 4 is hazard analysis, scoring and decision making. To determine the potential causes of each of the failure mode, you need to take the step 4, which is more towards each failure mode have multiple failure causes. The causes can be more in detail. So to determine the probability of occurrence of each of the potential causes by using the probability rating and the record of this HFMEA form, HFMEA form is there where table 3, or determine the hazard score by multiplying the probability score by this severity score. So use the hazard decision matrix that is given in the table 4 to determine if the failure mode warrants further action. If the score is 8 or higher than that, strong consideration should be given. Very important, where in compared to the decision tree that we have seen to further decide if you have to go for the step 5 or you have to work on that part. Record if a corrective action is needed and develop for each of the failure which is being given in the HFMEA form. Document the reason for not developing the action plan if the score is above 8, which is one a disastrous mechanism actually to take fast actually the decision which is still taken not to develop an action plan and why it is not being taken as. Now you can see in the table 4 and table 3 actually over here that there is a probability rating being given where we give remote, we give unlikely to occur, uncommon that a possibility to occur, or occasional can be possibility will occur that may happen like 1 or 2 times in a year, or frequent likely to occur immediately or within a short period, there might be like may happen in several times in a year. So you may see probability happening from 1 to 2 to 3 to 4 in form of a rating, where you can say the hazard decision matrix like catastrophic incidences were there, major were there, moderate were there, minor were there. But with respect to the high risk actually we can see 12 to 16 which has taken that they have taken frequent and occasional, where you may see the major that was frequent, moderate that it has been very less, and minor very less actually. We can see the risk is being given the lower risk 1 to 2, or from the median part we can say 3 to 6 which is median to lower risk, and medium to higher risk that is 8 to 9, and high risk it is 12 to 16. So this hazard decision matrix will help you to make a decision like how this can be seen in terms of the probability and severity of the occurrence of the event to the remote of those, which is one towards identifying how the severity is like from minor actually to catastrophic. In the step 5, develop an action plan, which is very important. When you are identifying the action plan for each of the failure mode to be corrected, use an HFMEA worksheet. What is this worksheet to be worked as? It is more to the process and outcome measures. It identifies the single responsible individual by whom to complete the recommendation or the action. So it is a sheet which gives you more about the record, the targeted date and responsibility, and which makes the plan more actionable. In the step 6, follow up and review. You have to think, you have to plan, and you have to go ahead with the recommendations which are given by the team. Documentation of your findings are very important, and it comes from the HMEA form. Now, when the recommendations are in action, it has to be implemented. The hazard score should be lowered down, and the probability of the failure mode cause need to be studied. Obtain the new hazard score by multiplying the severity times with the probability, and document on the HFMEA form. The new hazard score should now be less than the recommended actions, and you may see it should be towards reducing and the improvement on that part. So in summary to this chapter on HFMEA, which is being seen as a structured proactive risk assessment method, which is identifying the potential failures in the healthcare process, hospital, before the harm occurs. Start with the relevant topic, select, and a multidisciplinary team should be there. The process involved is mapping the process cares, systematically identifying the failures, analyzing the causes, and assessing their severity. Probability using the standardized rating tables. Then you have to work on the risk, as the risks are quantified through hazardous scoring, because it is not that it can be a word actually that you can explain the risk, but it is with the numbers that you can come across with severity with respect to the probability. And prioritize using the decision matrix to determine whether there should be a corrective action which is required or not. Action plans, as lastly as said, are developed for high risk failure modes, when you need to identify the clear responsibility, the timeliness, and define the process with respect to the outcome measures, whether it should be higher or lower. And also there is very important part with respect to sustainability, that is follow up and review, which should be ensured towards the continuous improvement. With respect to re-evaluation of the hazard score after implementation to confirm the risk reduction, and working towards strengthening the patient safety. We come and end to this chapter and have a discussion actually on this has made us to understand actually what the risk assessment method looks like and in what way need to take ahead the processes in terms of mapping it and systematically seeing it, the analysis for this. So thank you for your patience listening, and you can use these references for your projects. Thank you.